Hello friends, welcome to I Gurukul. Before going to start this today's session, I would like to request you all please subscribe my channel and hit the bell so that you will get all the notifications whenever I am uploading the new sessions on this platform. In this session, we will discuss about the hypermetropia. This is then the refractive condition of the eye. So we will go into the detail of about the hypermetropia. I have an activity in the beginning only. So I'll be asking you to go through the images. What are the different images you are seeing in the screen now? So the first image is, what is the condition of this image? It is in normal eye. So emmetropic eye. So what about the second? The rays of light focused in front of the retina. What is that condition? In the third image, the rays of light are focused behind the retina, and the fourth one has multiple focal points. So these are the different refractive conditions of the eye. So can you imagine what is the condition of this second image? So we will go through one by one. What is the correct answer? You will see. The first image, that is the emmetropia, where the refractive condition is normal, means the parallel rays of light coming from the infinity are focused on the retina with the accommodation is at rest. Okay. In the second image, the rays of light are focused in front of the retina. The condition is called myopia. Okay. And the third one is the behind the retina rays are focused. So the condition is called hypermetropia. And the last one is where the multifocal points are there, multifoci. So that means it's not an regular one single focal point even in the anterior before the retina and behind the retina. So this is what we call the astigmatism. Okay, beginning to the main session, we have here learning objective. At the end of this session, you will be able to define the hypermetropia. You will be able to describe the types and symptoms of hypermetropia, and you will be able to describe the complications in hypermetropia. Also, you will be able to explain the treatment for hypermetropia, and you will be able to explain the effect of accommodation in hypermetropia, and finally you will be able to explain the scientific correction for hypermetropia. Now coming to the definition of hypermetropia. This is the normal ocular emmetropic condition where the image is clear for the distance as well as the near, because the rays of light are focused on the retina. In hypermetropia, parallel rays of light focus behind the retina when the accommodation is at rest. Okay. Now, what is the difference between presbyopia and hypermetropia? This is the question. The expected answer is the presbyopia is an age-related condition in which the lens of the eye becomes less flexible. Hypermetropia will cause due to irregular shape of the eye. Okay, by the people by the age, including the babies, can be farsighted. So medical term, the term hypermetropia, hyper means excess, met means major, and opia means of the eye vision. Okay, which means to check the high vision power. Okay, this is the meaning of hyperopia or hypermetropia. Okay, now the hyperopia or hypermetropia, also known as the long or farsightedness. Okay, the hypermetropia patients are also known as hyperopes. Okay, here in this two images you can see the hypermetropic patient will be seeing distance clear but not the near things. So the first image, the top left side image, is showing the distance clearer, but then near objects where the child is working for some farm work is he is doing, but it's not clearly seen through the hyperopic condition. Okay. So moving towards the causes of hypermetropia. The first is decreased curvature in the cornea or a lens can cause hypermetropia. And the second one is decreased axial length of the eyeball, that can also lead to the hypermetropia. And the third one is the change in the refractive index, that can cause the hypermetropia. So these are the causes of hypermetropia. Moving towards the signs of the hypermetropia. Now you will see the many signs on the ocular structure. The smaller eyeball will be there and smaller cornea, shallow anterior chamber, squint may be there, optic disc is smaller in the hypermetropic condition. These are the ocular signs you will see objectively in the patients. So moving towards the symptoms of hypermetropia. So what are the symptoms? Headache will be there and eye strain, near blurred vision, difficult to doing close work, early onset of presbyopia, also similarly they will say these complaints, and convergence squints will be there. So these are the symptoms of hypermetropia. Moving towards the clinical types of hypermetropia. We have three types of hypermetropia. One is simple hypermetropia, that includes axial hypermetropia, curvatural hypermetropia, and then developmental myopia, hypermetropia, sorry. And then second one is pathological hypermetropia. This includes congenital hypermetropia, acquired hypermetropia, positional hypermetropia, and the index hypermetropia. And the last one is functional hypermetropia. These are the clinical types of hypermetropia. We'll go through one by one. Okay. The simple developmental hypermetropia, the average newborn eyeball is about 16 millimeter in diameter from the front to back. That is what we call axial length. Okay. In an infant, the eye grows slightly to a length of approximately 19.5 millimeters. The eye continues to grow gradually to the length of about 24 to 25 millimeter. As I said in the previous session, the average axial length will be 24 millimeter. Okay. Gradually the eyeball gets developed. So the axial length will be keep changing. Okay. So when the baby newborns will be found with the 16 millimeter of the axial length, and gradually it increase up to 24 to 25 millimeter, it will goes to the young and adult age. Now we'll see the simple, that is axial hypermetropia. So the due to the smaller eyeball size at the birth, all newborn babies have hypermetropia. Axial hypermetropia is mostly seen in cases like orbital tumor, inflammatory mass, edema, coloboma, and microphthalmus. As I said earlier, the normal axial length of the eyeball is about 24 millimeter. Okay, so this is about the axial hypermetropia. Okay, moving towards the curvatural hypermetropia. In this condition, in which curvature of the cornea, lens are both flatter than the normal. Increase of 1 millimeter in radius of curvature, it results in plus 6 diopter of hypermetropia. Decrease in the refractive power of the eye due to the flatter curvature of the cornea or lens. Okay. Now we'll see the classification into physiological or pathological hypermetropia. Okay. The physiological is normal biological variation includes axial and curvature hypermetropia. It may be hereditary. And the pathological reduction in the axial length due to the space occupying lesions within the eye, such as retinal detachment, central serous retinopathy, orbital tumors, retinal tumors, etc. Patient become hypermetropic in cornea plana and lens plana. Okay, these are the two conditions. Patient may be pathologically hypermetropic, you will see. Okay, moving to the congenital hypermetropia. This is the disorder in which the one or both eyes are smaller than the normal due to the changes in many genes involved in the early development of the eye. It occurs approximately 1 in 10,000 individuals. Okay, so this is the congenital hypermetropia. Now the second one is acquired hypermetropia. Okay, the absence of the lens of the eye due to surgical removal or the perforating a wound or an ulcer, or it's an congenital anomaly. The absence of the lens is called as the aphakia. Okay, and it is due to congenital anomaly, as I said, surgical removal also, okay, or perforating wound or an ulcer with the traumatic conditions. Okay, this is the acquired hypermetropic definition. So now moving towards the third, positional hypermetropia. The positional one is abnormal position of the lens, means crystalline lens position is misdirected. So the positional hypermetropia may be due to the posteriorly placed crystalline lens of the eye. Now pathological hypermetropia, we have option fourth one, that is the index hypermetropia. Okay, index hypermetropia occurs due to the change in the refractive index of the lens in old age. It may be also occur in the aged or in a diabetic patients also. Now moving towards the functional hypermetropia. Functional hypermetropia is due to paralysis of accommodation. It affected by the paralysis of the accommodation. Functional hypermetropia is usually present at the birth. The process by which the ciliary muscles change the focal length of an eye lens to focus distance or near objects clearly on the retina, that is called accommodation of the. Now moving towards the effects of accommodation. Okay, so the hypermetropia which is seen after complete paralysis of accommodation after the application of atropine. The facultative hypermetropia, which can be corrected by the efforts of accommodation or excessive strain on the ciliary muscles. And the second one is absolute hypermetropia, cannot be overcome by the active efforts of accommodation. And the manifest hypermetropia is determined with non-cycloplegic refraction, and the latent hypermetropia is determined with the cycloplegic refraction. It causes due to the overfunctioning of ciliary muscles. Total hypermetropia, that means manifest hypermetropia plus latent hypermetropia, that is totally we can call total hypermetropia. Now we have clinical indications to find out the types of hypermetropia. Okay, here the manifest hypermetropia, the strongest convex lens with which the patient can still maintain full distance vision 6/6. It indicates the manifest hypermetropia. Okay, and the second one is absolute hypermetropia. If the patient cannot normally see 6/6 without a lens, then the weakest convex lens, that will allow him to read this line. This indicates the absolute hypermetropia. And the third one is facultative hypermetropia. Facultative hypermetropia, as I mentioned, the manifest hypermetropia minus the absolute hypermetropia. Okay, so these are the clinical indications to find out the type of hypermetropia. Now, what are the changes occurs with the age, and that can be vary your hypermetropic condition. Normally, eyeball is smaller than the normal, that is normal length is 24 millimeter average, and in hypermetropic condition this size will be smaller than the normal at the birth. When baby grows, the eyeball also grows. Okay, at the birth you may find +2 to 3 diopter of refractive correction for the, or you will find the dioptric value at the birth. At the age of 5 years, 90% children are going to normal, because as the age grows, the eyeball length is going to change. That means the eye is going to develop, so the axial length will increase. At the teenage, almost emmetropia, normal vision. Okay, so these are the variation according to the age growing. So moving towards the hypermetropia grading. So we have three gradings here. One is low, medium and high. Low means 0.25 diopter to 3 diopter. Medium is 3.25 diopter to 5 diopter, and the higher one is greater than 5 diopter of the refractive status. The D indicates here the diopter. Okay, the refractive power is measured in the diopter. So now, how will you diagnosis, and what are the steps in the diagnosis of the hypermetropia? So visual acuity is the primary action to find out the hypermetropia or any refractive condition of the eye. Visual acuity varies with the degrees of hypermetropia and power of the accommodation. Patient with low degrees of refractive error may have normal visual acuity. However, there is decreased in visual acuity for seeing near objects. And the second test will be cover test. Cover test reveals an accommodative convergent squint due to the altered accommodative convergence and accommodation balance, that is what we AC by A ratio called. Maintaining the binocular vision become difficult. The advantage of binocular vision are sacrificed in favor of more obvious advantage of the clear vision. The better eye dominates for vision and the other eye develops accommodative convergent squint. And the next one is anterior chamber assessment. Anterior chamber is relatively shallow in high hypermetropia. And then moving towards the fundus examination. In the fundus examination, it shows the size of the optic disc, swelling of the disc, and the which causes the hypermetropia. And the last one is ultrasonography or biometry. A scan ultrasonography or biometry may show decreased anteroposterior length of the eyeball, that is the axial length. Okay, so these are the diagnostic steps for the hypermetropia. Coming to the treatment options for the hypermetropia, we have a basic treatment, that is the optical treatment. In this, we prescribe the convex lens to converging the incoming rays of light to focus properly on the retina. And these convex lenses are called as plus lenses or converging lenses. So a convex lens is thicker at the center and the thinner at the edges. So you can feel those lenses, you can handle multiple lenses, you can easily identify the type of lens which is the convex lens. Okay, the optic center will be thicker in the middle at the, and thin will be at the edges. Through these lenses, when you look at some different objects or at different distance, the objects will appear enlarged. For example, a magnifying glass used by an palm reader. Okay, so you people may saw many magnifying lenses. Those have convex lenses, and the object will be look closer with these convex lenses. The second option is surgical treatment. We have keratophakia, that means keratoplasty in which corneal tissue from donor to recipients. During this process, they frozen and shaped the cornea and inserted into the cornea during the surgical process. And the second one is epikeratophakia. It is the surgical correction of aphakia. It is a refractive surgical procedure in which donor cornea is transplanted to the anterior surface of the patient's cornea. And the third one is keratomylosis, the surgical reshaping of the cornea carried out in order to prevent or correct the refractive error. Okay, these are the surgical procedures to treat hypermetropia. Now the next advanced photorefractive keratoplasty, that is the laser therapy with excimer laser. Peripheral cornea is made thinner with the laser, thereby cornea becomes more convex. Okay, this is the procedure we do in the LASIK or in laser treatment we do give to the treatment option as an hypermetropic patients. So moving towards the complications of the hypermetropia, you may be seen strabismus and primary narrow angle glaucoma, lead diseases and amblyopia. These are the main complications seen in many patients with the hypermetropic condition. Now again activity time. So I would like to request you all to take the plus powered high powered lens and look through the lens, focus on the any single object and then move the lens horizontally, vertically, closer, away from the eyes, close to eyes. Just look through the lens, how you will see the images through those lenses. Okay, so with the plus lens you will see the image will be magnified and the movement of the objects are opposite direction. If you move your lens towards your right side, the object will move towards the left side. So these are the different movements you will see with the plus lenses. If it is your lens is higher, the movement will be faster. If your lens power is smaller, and then the movement will be slower. So this is the activity what you can do with your trial lenses. Okay, just as an recall what we learned in this session about the hypermetropia, what are the causes, types, signs and symptoms and treatment options are available for the hypermetropia. I request you all, if you have any doubts in your mind or any questions related to hypermetropia topic, please do write on the comment box so that I can answer you all questions. So before going to end my this today's session, I would like to request you all like my session and comment how you felt during this session, what knowledge you gained, and share this video with your friends, family friends or family members, those who are interested to learn. Okay, and finally don't forget to subscribe. Okay, so see you in the next session, that is astigmatism. Okay, thank you.